Did you know that there were about 7 million children diagnosed with ADHD in 2022 alone? It's one of the most common neurodevelopmental conditions in the world. But while public awareness of ADHD has increased, many misconceptions and lesser known facts still persist and affect the understanding, diagnosis, and management of the condition. So let's take a deeper look into ADHD and shed some light on the often overlooked aspects of it. Number 1. ADHD is not just a childhood disorder. Many people think that ADHD only shows up during early childhood, ages 3 to 7, and that they outgrow it as they age. However, research says ADHD often continues into adulthood, with approximately 60% of children diagnosed with ADHD experiencing symptoms into their adult years. And it might not look like what you are accustomed to identifying as ADHD. For example, instead of issues with hyperactivity or impulsivity, they may struggle with time management and organization as ADHD affects people's perception of time. For example, they may over or underestimate how long a task will take them to complete, which can greatly impact their day-to-day life. Number 2. High energy is not a sign of ADHD. Have you ever heard someone say something along the lines of, "That kid cannot settle down. They probably have ADHD." The reason ADHD is a common diagnosis in children is because their excitability, where they might be constantly running around, jumping, or fidgeting, gets misinterpreted for hyperactivity or inattention, common symptoms of ADHD. Additionally, boys have a higher chance of being diagnosed with ADHD because they often exhibit hyperactive symptoms that are commonly associated with ADHD. There is concern of misdiagnosis or a biased diagnosis as ADHD has no pathogenic markers. Sex, cultural norms, and even length of assessment can all be factors that affect the diagnosis. Because of this, doctors recommend waiting until they reach developmental maturity, around the age of 7, before doing an assessment. Number 3. Gender differences in ADHD. Did you know that girls are usually underdiagnosed? Society has almost conditioned us to associate ADHD with hyperactivity and impulsivity, which is why boys are more likely diagnosed. But ADHD often presents differently in males and females. In contrast, girls exhibit symptoms associated with inattentiveness, which is less disruptive and therefore less likely to be identified as ADHD. As a result, many girls and women with ADHD remain undiagnosed or misdiagnosed, leading to a lack of appropriate support and treatment. Number 4. ADHD affects more than just attention. While the term attention deficit might imply that the main issue is sustaining attention, ADHD actually encompasses a broader spectrum of symptoms. These include impulsivity, hyperactivity, emotional dysregulation, and executive function deficits. It's why those with ADHD often struggle with some areas of daily functioning that usually involve high-order processes. In childhood, it may look like inattention, constant fidgeting, as if driven by a motor, and impulsive behavior, which can get in the way of their learning. In adulthood, it may involve difficulty focusing, inability to prioritize, always running late, among others. Number 5. The role of genetics and neurobiology. We don't know what causes ADHD, but doctors have acknowledged the role of genetics as a factor. ADHD is heritable, with genetics playing an important role in its development. In a recent analysis of twins, researchers found that ADHD has a heritability of 78 to 88%. It is associated with differences in brain structure and function, especially in areas like the prefrontal cortex, which is associated with executive function, attention, and impulse control. In fact, neuroimaging studies have shown differences between an ADHD neurodivergent brain and a non-neurodivergent brain in the size and activity of certain brain regions that are crucial for self-regulation and decision-making. Number 6. Relationship with other disorders. Why is it so hard to figure out if someone has ADHD? Well, ADHD often coexists with other psychiatric and developmental disorders such as anxiety disorders, depression, learning disabilities, and conduct disorder. This comorbidity complicates diagnosis and treatment, since symptoms of ADHD can overlap or mask those of other conditions. If you have concerns, reach out to your licensed medical therapist for a comprehensive evaluation to address the full spectrum of your challenges. Number 7. The controversy around medication. A common treatment is medication, particularly stimulants like methylphenidate, Ritalin, and amphetamines, Adderall. However, there's ongoing debate about the long-term effects of these medications, potential for abuse, and the notion of overdiagnosis and overprescription. But medication can be part of the solution. When medication is combined with behavioral therapy, lifestyle changes, and support, treatment and management for ADHD can be more successful. Number 8. The potential for positive traits. We often look at ADHD through the lens of its challenges, but it's important to look at the positive qualities as well. Many individuals with ADHD are highly creative, energetic, and resilient. They might thrive in dynamic environments that require quick thinking and adaptability. Recognizing and nurturing these strengths is just as important as addressing the difficulties associated with ADHD. Number 9. Ongoing research and advocacy. ADHD research is continually evolving. There are ongoing studies exploring its causes, treatment, and long-term outcomes. Also, advocacy efforts aim to increase awareness, reduce stigma, and promote policies that support individuals with ADHD across their lifespan. Continued education and advocacy is essential for understanding and supporting those with ADHD. It's crucial to challenge misconceptions and foster a more nuanced understanding of ADHD. In this way, we can better support those with ADHD in achieving their full potential. Did you learn something new about ADHD? Are there other aspects you'd like us to go over? Feel free to share your thoughts in the comments. If you like this video, be sure to hit the thumbs up button and subscribe to Psych2Go for more content. Thank you for watching. Until next time.